Welcome to Module 2, Systems Planning 101, brought to you by the Systems Planning Collective. This module is part of the Systems Planning Collective's curriculum. The full curriculum will be hosted on the Homelessness Learning Hub. Throughout this module, we encourage you to write down any questions you may have and then head over to the discussion forum on the Homelessness Learning Hub to start a conversation. Systems Planning Collective members will review these questions and get back to you. I'm your host, Lindsay McRae, and I'm a Communications Officer at the Canadian Observatory on Homelessness. Now I'll introduce you to your instructors. Anika Mifsud, Postdoctoral Fellow at the Canadian Observatory on Homelessness, and Alina Turner, Principal of Turner Strategies, co-founder and CEO of helpseeker.org, and Fellow at the School of Public Policy at the University of Calgary.
Thanks, Lindsay. Welcome to Module 2, Systems Planning 101. On behalf of the Systems Planning Collective, I'd like to thank you for taking the time to review the content presented in Module 2. Similar to Module 1 and the upcoming Module 3 and 4, our hope is that you'll review the module content alongside the other accompanying materials. Today's learning objectives essentially are to give you a basic understanding of the Systems Planning Collective, what systems planning really is, and what it entails. We'll also give you a big picture view of systems planning and where systems integration and systems mapping fits in. But the idea is, as this is an introductory module, the concepts and ideas presented should be straightforward and easy for any type of audience to understand. And before we continue, I'd like to introduce myself. My name is Anika Mifsud, and I'm a postdoctoral fellow at the Canadian Observatory on Homelessness. I'm one of the members of the Systems Planning Collective, and I'm so grateful to have you join us today. All right, let's begin. The Systems Planning Collective, otherwise known as the SPC, is happy to support the needs of communities across Canada in your systems planning work. We are a group of individuals who are here to support you by providing resources, training and technical assistance, and capacity building. As mentioned in Module 1, our goals are to support communities in preventing and ending all forms of homelessness in Canada by working collectively. We hope to do this either by supporting you to do the work on the ground in your local communities or by acting in more of a consultative role. The way we hope to do this is by providing resources like the modules you're engaging in currently, by building capacity within your community, providing training and technical assistance, or by building partnerships and engaging in a more hands-on process. As you may have seen in the accompanying documents in Module 2, there is a glossary of key terms included. So let's go over some of the key terms quickly. All of the key terms can be found in the glossary for you to review more closely at a later time. I wanted to overview the importance of having a common language when engaging in systems planning. Because systems planning is so collaborative with multiple stakeholders, it's really important that when we talk about systems planning, we're all talking about the same thing. This allows us to communicate more effectively and is a critical part of the systems planning process. Before we can talk about systems planning, we should go over what a system is. A system is a collection of organizations, people, and actions that interact together and share a primary goal. So in our context, that's a homeless serving system interacting together to end homelessness. Systems planning, however, is the analysis, planning, and design of an integrated system that works together towards a common end. This can't be done without systems integration, where different systems work together as a whole. When that occurs well, we then see systems change happen, where a lasting change in the way a community thinks, makes decisions, and delivers services can be seen. Systems planning can't be done without a dedicated planning table, which is a collection of organizations that come together to do systems planning work. Good systems planning also includes systems mapping, which is an up-to-date resource directory of all services available for those at risk of or experiencing homelessness. Now let's dive into what systems planning really is and what it requires. Systems planning occurs when we shift our system from doing things in a program by program basis towards a more systems approach. The best way to do this is to frame our conversations and our work around preventing and ending homelessness by following a housing first philosophy. So when we say we're following a housing first philosophy when we conduct systems planning, we mean that everyone has a right to housing, that it is a basic human right, and that there are no preconditions to receiving housing. Within systems planning work, there are several foundational concepts that need to be considered. First, that systems planning is grounded in using evidence-based solutions, that it entails stakeholders taking a leadership role and having accountability, and that their work is driven by data, best practices, performance management, and human-centered design. Finally, that effective systems planning moves away from crisis response and instead towards permanent housing and homelessness prevention. Systems planning has several key aspects that need to occur in order for this work to be successful. Your planning and strategic development must follow a systems approach, meaning that it should be collaborative and engage with multiple systems. There must be an organized infrastructure in place so that you can coordinate efforts towards preventing and ending homelessness. You must have an effective and up-to-date systems map in progress to allow for your community to make sense of what resources exist. This will allow you to streamline your efforts moving forward. Effective systems planning also has coordinated service delivery to allow for the easiest, most efficient, and cost-effective flow-through for service users, as well as the best systems level outcome. You need some sort of integrated information management system to allow for effective data collection, reporting, intake, referral, and assessment. This could be through HIFIS or HMIS. You also need proper performance management to measure quality at both the program and system level. And finally, you need systems integration between the key systems that work alongside the housing and homelessness sector. So for example, this could be health, justice, child welfare, and poverty reduction. Though it may seem obvious, it's really important to outline why these specific criteria are necessary for effective systems planning. For systems planning to occur efficiently, we need to change the way we think. If you remember from the key terms, this means engaging in systems thinking so that you can understand not only the basic requirements of a system, but also the complex ways that different systems relate to each other and how they function together as parts of a whole. We need to engage in systems thinking so that we can ensure that we have proper alignment across the system and achieve maximum impact. As we know, homelessness is a complex social issue that needs an all-hands-on-deck approach. In order to continue making big strides towards reducing, preventing, and ending homelessness, we need to engage in systems planning in a more purposeful and strategic way. As you can see from this graphic, it really conceptualizes the idea that systems planning is guided by a housing first philosophy and how your system of care operates. So, the housing first philosophy is really the guiding force behind your programs, but also the system restructuring as well. However, depending on where your community is at in terms of systems planning, your programs may already be embedded within housing first, but they might not yet be operating at a systems level. Although I won't go in depth into the components of housing first, this slide demonstrates some of the key values that guide systems planning within a housing first philosophy. Systems planning puts the service user first and at the forefront. It values strategic and purposeful collaboration using innovation and creativity to solve real-world problems. We recognize how important a group effort is for preventing and ending homelessness in our communities. Systems planning does this within a housing first philosophy by using human-centered design thinking. While this module won't go into depth into how that's done, The idea is that we strongly believe that systems should be designed around the service user. As mentioned earlier, in order to do this and do this well, we must be innovative, quick to respond, and agile. I'd like to switch gears a little bit and contextualize what your role may be in the process of systems planning. It's important to really dive into demonstrating where you and your community partners fit so that we can begin to engage in that systems thinking process. I'd like to go over what systems planning may look like within the homeless serving system. The first element would be to define what fits within the scope of your homeless serving system. Who are the key players? When we talk about a homeless serving system, we're talking about a local or regional system that is serving those who are at risk of or currently experiencing homelessness. Remember, this may differ depending on your community, but this may also include your nonprofits, your municipal government, the public sector, or the health region, for example. While some service providers within a local or regional system may think they're not part of the homeless serving system because they serve a broad scope of service users who may not all be experiencing homelessness, so for example, the public healthcare system, if they're providing services for those at risk of or experiencing homelessness, then they are part of the homeless serving system. And while they may not be your typical players, it's totally acceptable for there to exist some fluidity within different systems. Again, it's really important to analyze who fits within the homeless serving system so you can begin to engage in systems thinking and think about the relationships between your homeless serving system and other systems. When engaging in systems planning within the homeless serving system, you need a method of organizing and delivering services appropriate to your service users. When systems planning is done well, rather than doing things agency by agency or program by program, the goal is to prevent and end homelessness in a coordinated way. Good systems planning also has organizations that are working together towards the same goal of ending homelessness. This is the basic cornerstone of what systems planning actually is. Typically in communities, having a community plan is a great way to not only ensure that collaboration is occurring between organizations and systems, but that a common goal is set for your systems planning work to move forward. While this may seem really obvious why collaboration is necessary, typically it's easier said than done. Different funding agendas and organizational mandates may make collaboration on a community plan and its goals difficult. However, having those tricky conversations is a critical part of the systems planning work. Systems planning within the homeless serving system also ensures that there is a clear line of sight for those on the program level. It allows for individual programs to be a part of the success by not only ensuring that their voices are heard on the front lines, but also that community plans are operationalized in a realistic way into what it would actually look like on the day-to-day level. Finally, systems planning also allows for tangible metrics to be created to assess your program and system level success. Remember, the ultimate goal of effective systems planning is to witness real systems change occurring at all levels. These 5 key elements are important to keep in mind when thinking about what systems planning in the homeless serving system actually entails. Now I'd like to switch gears and talk about how systems planning may affect those who are more on the ground, say at the service manager level, or those who are acting as a systems planner organization. In Canada, we typically see systems planning occur when a community-driven approach where change occurs from the ground up. As you may know, through Reaching Home, community entities are required through federal agreement to champion the work towards ending homelessness. They are the lead organization that lead local efforts. Sometimes they begin after community plan has launched, and sometimes they're the funders as well. The systems planning organization is more involved in service delivery and funding functions. They take on the systems planning operational work. For example, they would be the one to lead their community through the development of an integrated information management system like HMIS or HIFIS, or creating performance management standards across the system. Typically, we see the system planner organization located in either nonprofit organizations or within a municipality division or department. Finally, we also recognize the community consultative work that goes into supporting the system planner organization. This is done through the community advisory boards or other organized groups with lived experience councils. This is a critical part of the system planner organization, and these community consultations are done so that any systems planning that occurs has the support of the community as well. We can't talk about systems planning without talking about what it looks like from a big picture perspective. When designing the system, one of the ways systems planning works is it relies on data about demand. Some key questions to ask when engaging in systems planning is who needs our support, what are those needs, and how many people need them? When we ask who's experiencing homelessness, this allows us to structure our homeless serving system in a specific way to support effective programming. This graphic demonstrates the classic way we break down the different types of homelessness experiences. These percentages may not be completely representative of your community, but it's there to give you an idea of scale. Typically, you have the majority of your homeless population fit within the transitional homeless category, where homelessness is brief and non-reoccurring. The episodically and chronically homeless are a smaller portion of your homeless population, but typically have a higher need or acuity score. I wanted to show this graphic to demonstrate what I mean by varying levels of acuity and need and the type of programming or interventions that may correspond. Many communities use different tools to assess acuity, sometimes even differing at the organization by organization level. While I won't go over the different acuity assessment tools, it's important to note that for effective systems planning, having some agreement at the community level on what you're going to use to assess acuity is very critical. It's less important what you pick, but it should be evidence-led and it should be done consistently. This is a great graphic that demonstrates what systems planning in the homeless serving system can look like. You have coordinated access, where individuals have access to the same information and level of service, assessment, and program matching when they enter the homeless serving system. Coordinated access can either occur through a one-stop shop, where all individuals go to one location first, or diverse agencies that might be acting as a coordinated access model. The process with program matching, assessment, and criteria is the same no matter what you have in your local community. Everything flows from that coordinated access and program matching point. So ideally, you may move towards the off-ramp of prevention, or you may move towards the off-ramp of diversion programs. But if someone is experiencing homelessness and needs to go through the system of care, then they're able to move through the housing options that are available in your community. What I love about this graphic is that emergency shelters are a bus stop on the road and not a destination itself. What we mean by this is that it's important to acknowledge that emergency shelters are a vital part of the homeless serving system, but they're not the final destination for individuals experiencing homelessness. The wooden sign on the left demonstrates the different entry points into the homeless serving system. This is important because it demonstrates that the homeless serving system is not designed for just one type of homelessness experiences. For example, those that are just sleeping rough or in emergency shelter. It's about effective systems planning with other systems like corrections or the healthcare system or child welfare, for example. I'd like to quickly touch upon how the process through an effective system should look like. First, you have your referral process. This needs to be aligned in your community through coordinated access. Next, eligibility criteria needs to be transparent and aligned to system objectives. We need to have service standards across the system so we understand who does what and at what level. Client engagement is also necessary at the system level. Finally, aligning privacy and safety standards within your system is one of the most necessary components to your system process. All of this is, of course, easier said than done, but it falls within the responsibility of the system planner organization and within designing an effective homeless serving system. I'd also like to touch upon the importance of performance management when engaging in effective systems planning. When engaging in systems planning, performance management allows the expectation of good performance to be aligned and monitored so you can achieve the targets in your community plan. Having performance management allows you to articulate what your system hopes to achieve, and again, using your community plan to create targets is a good way to make sure you're hitting those goals. It allows you to engage in evaluation and have a better understanding of the impact you're having on your target populations. It empowers service users as well, since performance management ensures that there is quality assurance at the program and system level. It promotes service integration so that you're not duplicating services and you're ensuring that everything is streamlined and working as efficiently as possible. And finally, it allows you to really illustrate what a good systems plan looks like in terms of performance and the level of performance that is expected of all the players in your system. Again, because this is an introductory module and just an introduction to systems planning, I won't go in depth into the different ways that performance is measured. But I will mention that different measures exist for different purposes. Some key questions that you may have when measuring performance may be around effectiveness. So for example, are we meeting our intended outcomes? Efficiency, are we maximizing our resources to achieve our goals? And quality, are we hitting those goals with the best quality we can for our clients? These can be measured using different outcomes, and again, may differ from community to community, but what your outcomes look like is an important part of your community plan and an essential aspect of systems planning. The Systems Planning Collective provides an entirely separate webinar on coordinated access and what that looks like at the community level, but I'd like to give a quick overview to set the stage. So what is coordinated access really? Coordinated access is a coordinated process for people to access housing services. This process, as shown through this flowchart, demonstrates the step-by-step way that an individual entering the homeless serving system can receive services. It begins with having the same accurate information available to all service users. This is done through effective systems mapping. You have a screening tool that determines what type of services an individual will need. Effective coordinated access has prioritization so that the people who need the most help get it the fastest. You must have an initial intake and assessment process. As you can see, to have effective coordinated access, you must agree on what evidence-based tool you will use to measure acuity and undergo your assessment process. Once that is conducted, you have your referral process, and once all of those steps are undertaken effectively and as efficiently as possible, you'll have a housing plan and a process for moving the service user into permanent housing. A key component of effective systems planning is having an integrated information management system. One example of this is HMIS, or Homeless Management Information System. HMIS provides key insights into what homelessness looks like in your community right now. This allows communities to not only plan effectively, but be efficient and focus resources where they'll have the most impact. Again, this is an introductory module, so we won't dive into what integrating real-time data into your homeless serving system means and what it looks like. But it's important to overview that by having an HMIS in your community allows you to be as efficient with not only funding dollars, but with providing services to your service user. It allows for an unduplicated count of your shelter population longitudinally so you can see over time where gaps exist. Agencies can track progress at the client level so that no one falls through the cracks, and funders can use HMIS to assess how the system is performing. HMIS is more than just a client database. It's the infrastructure that allows you to do systems planning as effectively as possible. I'd like to tie up all of these pieces so you have a big picture understanding of coordinated access and the importance of having a streamlined process for service users to flow through. Coordinated access ensures that we have a common process to ensure that program matching, prioritization, and streamlining is occurring for all service users within your homeless serving system. It matches service users to programs appropriately through common assessments. It provides information, screening, referral, and intake through either a one-stop shop or through multiple access points. Remember, it doesn't matter how you do it, but that your community is all on the same page. It's not a one-size-fits-all solution. It's a fluid and nimble process. The great thing about systems planning is that you can adjust how you provide services based on the shifting needs in your community. Ultimately, coordinated access is a coordinated way for communities to come together to provide access to housing supports as efficiently and as effectively as possible for service users. Now I'll pass it on to my colleague Alina, who will talk about systems mapping and the importance of having an integrated approach when conducting systems planning.
Hello, everyone, and thanks, Anika, for that excellent introduction and overview of Systems Planning 101. I wanted to take the opportunity to go a little bit deeper into systems mapping and how that fits in. And just a reminder of who I am, Alina Turner, and I'm the principal of Turner Strategies and co-founder and CEO of Help Seeker. I also have an appointment at the School of Public Policy at the University of Calgary, where I do some of the more academic researchy work. So let's get into systems mapping and why it matters in particular. So why does systems mapping matter? And as you can see from this slide, and this is from a study that we did through the School of Public Policy, we examined the investments that are coming into the social safety net broadly in Canada and tried to discern about the expenditures on homelessness related services. So things like mental health supports, addictions, homelessness specific services, but also things like violence and poverty. And as you can see here, we estimated that about 170,000 different services exist at the same time across the country. And we think that's still not fully representative of the complexity that's going on the ground. So every agency has a number of programs. Each program delivers a number of services, and each program has their own eligibility criteria, their referral processes, etc. So it makes it really difficult for people that are trying to navigate the system to understand who does what and where they can go for help. And we hear this over and over again on the ground for those of us that do research at the front lines, or those of us that work on the front lines as well. This is nothing new. Now, the ramifications of this is, of course, that people are not making their way through and might fall through the social safety net and end up in homelessness. So it's really important that we understand exactly what's going on at that bigger ecosystem level. And on a decision-making level, if we don't have real-time information on the systems map on what's going on in our community, then obviously we're not going to make the best decisions on what gaps we have to fill and where duplication might lie that we need to address. And that's really why systems mapping matters in the big picture. Making it even more operational, those of you that are working on things like coordinated access, so the idea of enhancing access through systematic and coordinated processes for people to get from A to B, so from a state of homelessness into housing with the supports they need to thrive. To do that well, you have, of course, your by names list, where it's essentially a list of demand, right? And the other side of that, of course, is the supply. So the supply-demand balance would ensure that your coordinated access is not just categorizing folks by their needs and making referrals into nowhere, but there's actually somewhere that you can refer people to. So the example that we highlight here is through the Systems Planning Collective work using the Help Seeker platform, and that's a systems mapping platform that helps people methodically do their systems map and coordinated access matching work with the broader social safety net services. So what we have here is a list of folks, the by names list, and the various needs that they might present with, and the coordinated access process would support them getting access to the various services in the community. Now, these services may or may not be homelessness related specifically, and we know this very well from our work around prevention, that sometimes people present with a transportation challenge or a daycare challenge, is not to necessarily streamline everybody into the homeless serving system, but how can we support them hooking into mainstream or the broader social safety net so that they don't end up in the homeless serving system to begin with. And that's why the systems map broadly is so critical to support communities to achieve this at the decision making and at the practical coordinated access operations level. So taking this forward and bringing back some of Anika's key points around human-centered design thinking and putting the people that we serve at the center of this work, we wanted to again remind you at this point that it's okay to learn from failure. It's okay to learn from experimentation. That's what design thinking is all about. And having that approach to coordinated access and to your systems mapping work is going to be a really important approach to ensure that we have a continuous improvement mindset as we move through this work. And so that includes things like empathizing, defining the problem, ideating the problem, prototyping, testing, and iterating with those that have lived and living experience and the frontline service providers. So it's not just about us cooking up a systems map by ourselves and then imposing this on the system. It's really co-creating the systems map and taking that design thinking mindset to support breakthrough and continuous improvement. So I really encourage you to consider these concepts as you think through systems planning in your community as well. And so this is exactly the point around Help Seeker as a systems mapping platform. And this tool was developed in community as well. It's through that design thinking approach and agile development that we understood things that needed to be part of a systems mapping process. So whether you use Help Seeker or whatever other systems mapping tool you might consider, even things like Excel or Google Sheets can be used to support this work, depending on where you're at. But the key concepts that we wanted to emphasize in your systems mapping work are listed in the diagram. So the social asset mapping, so the actual mapping and categorizing of services, programs, and organizations, as well as their location, eligibility criteria, capacity, and occupancy. Those are basic 101 things that we need to know about the homeless serving system, but as well as the broader social safety net that our people with lived experience have to navigate as they move through services. So it's important that we have a basic understanding of this, and that needs to also be a real-time and constantly shifting tool, because of course programs come and go, services change focus, target populations and eligibility criteria are constantly shifting. So whatever you're doing, you need to have a mechanism to ensure this is a living systems map. The other piece, and this is the second component, is that you want to have a mechanism to track key analytics around service demand and gaps within your systems map. So for instance, you want to know that there's a spike in hits on your emergency shelter this week comparison to previous months or previous years. You want to understand that there's not as many people looking at the food bank this year, and what relationship does that have to your shelter statistics and the shelter hits? So you want to have a mechanism to capture information about how people are interacting with your systems map in real time to help you make decisions about your service network and how you want to integrate these into your systems planning work more broadly. And this happens at the leadership level, whether you're developing a plan on homelessness or poverty, etc. This also happens at the ground level when you're designing new programs and finding gaps that you need to fill from a service delivery perspective. And then the third component is these online resource directory that we encourage everyone to develop. The world has moved from the analog era into the 21st century, and everything is moving towards digital platforms to ensure people have access to services, whether that's a youth or a senior. Actually, seniors are the highest or fastest growing demographic of internet users. So the way that we're receiving information about services and the way that we're accessing services, help services as well, is shifting. And so we encourage you to not hoard this amazing information about your system and your systems map and turn that into knowledge that is widely available and accessible to the public. From a prevention perspective, you can see how that would be critical for somebody looking for assistance. So wanted to now take us into a discussion around systems integration, and Anika did a great job explaining how we organize the homeless serving system and the services that are directly targeting interventions for those experiencing risk of homelessness or in homelessness already. But our philosophy is that we believe in an integrated approach across systems of care, and that includes things like education system, the healthcare system, corrections, justice, even things like poverty reduction and income assistance. They're all connected as part of a social safety net that Canadians are very proud to have. So we would be amiss to not take an integrated lens into our work as well. So let's dive in to understand this further. And one piece that we wanted to challenge everyone's thinking on is to rethink integration. And so back in the beginning of our work around homelessness, we tried very, very hard to define the homeless serving system and put boundaries on who was in and who was out, so to speak. And similarly, we placed those boundaries through eligibility criteria and prioritization processes onto people looking for assistance as well. And I think you'll all be familiar with this approach of trying to contain the waves of demand that we saw coming at the homeless serving system by creating enhanced criteria so that we could meet that demand more effectively, which is a very normal reaction from a systems planning perspective. However, we wanted to challenge ourselves a little bit and say, well, we do have a much bigger social safety net that we should be leveraging in this work. And what exactly is this homeless serving system anyway? So after we spent a whole hour telling you what it is, we now want to break down these boundaries and acknowledge that these boundaries are quite fluid. And the same agency that might be delivering the shelter in your community might also be doing a corrections program for people coming out of jail and integrating back into community. They might have a daycare program at the same time. They might do housing, they might do education, etc. So homelessness services are really part of a broader nexus around social and health challenges in your community. And so you want to understand exactly how they intersect with these broader public systems and services that might be delivered by charities and nonprofits, and in other cases, private sector players. So with that in mind, let's dive a little bit deeper into this idea of integration and what that looks like at the delivery level. So one common way for us to think about integration is through the different strategies that we use to enhance it or to achieve integration. And I wanted to give you a little bit of an overview of the so-called best practices around systems integration, and just to contextualize what you might be doing as part of a bigger body of work in this area, and also to give you some ideas if you're looking at ways of creating more integration and enhance that within your public system or nonprofit charitable sector. So the first thing is common policies, protocols, and shared information. So it's really difficult to do integration if there's no systems level policies and protocols around this. And without sharing information, it's obviously going to be very difficult to share key resources and to do coordinated case planning for clients. The second piece is coordinated delivery and training. And so if you're in a homeless serving agency and you're wanting to do some work with a high acuity population that also requires health interventions, you need to have some capacity to do delivery in a coordinated fashion. And it's also useful to do training across the front lines together so that we're all speaking the same language and using similar concepts and practices in our work. Having staff with the responsibility to promote systems and service integration is essential as well, because these concepts require champions at organizational levels throughout different systems and throughout an organization, especially when that organization is a health system, for instance. The idea of a local interagency coordinating body or some type of committee that works on integration at that systems level. So an example of this would be the Calgary Systems Integration Table, where the key decision makers of health or the United Way, the homeless serving funders, so the Calgary Homeless Foundation, come together to discuss strategy around systems integration. So having some mandate from decision makers that this is the right thing to do and have that reinforced is really important. Centralized authority for homeless serving systems planning and coordination. So it's really difficult to organize with other systems if there's no lead agency within yours. And Nika talked about the systems planner organization as having that key role. So again, if you don't have a clear systems planner, this is where they come in from a systems integration perspective. And some of the more familiar ways that we think about integrating are this like co-location model. So where we have let's say income assistance workers from the government that is responsible for social assistance coming in and co-locating in a shelter. And this idea of co-location or one-stop shop is very, very common as an integration strategy. And then, of course, an interagency management information system. And we talked about the homelessness focused one, but we need now to find some ways of sharing information or at least moving information between systems. And of course, there's a whole slate of challenges with that at the community level you need to overcome. And in future modules, we'll tackle privacy and data sharing protocols in more depth. Suffice it to say, just because it's hard to do or complicated doesn't mean that it's not been done or is not worth pursuing further. So just some ideas about successful integration that can be achieved through some of these strategies. Let's go deeper into how you can engage in systems integration work. And this is coming from a study that myself and Diana Crezi did in 2019 called Bringing It All Together, Integrating Services to Address Homelessness. And here we went through the evidence on effective and efficient efforts in systems integration that actually got us client and system level outcomes. And the reason this is important lens is because just doing busy work and calling it integration doesn't necessarily mean you're going to get integration. In fact, we found that in some contexts, it created more administrative burden on agencies and frontline staff, and in some cases even made client outcomes worse. And so in this paper, we give a framework for those of you considering systems integration work on how to assess what's happening in your community, So whether it's an advisory body on systems integration, whether it's a special pilot, etc., and take it through these 6 tenets, from objectives clarification to strategic planning, leader coordination, continuous improvement, and information sharing, and just assess it against these tenets to determine whether what you're doing is working. And if it's not working, we always say, don't keep doing what's not working. Either shift it or retire it, and that's okay too. The big 4, I guess, conditions that we recommend and consider to be prerequisites for solid integration work are listed on this slide, and it starts with resource alignment. So ensuring that funding is coordinated and moving in the same direction. Again, it's the worst thing when you're, as a funder, you're trying to move the system in a particular direction, and then you find out that a fellow funder made a decision that completely undoes what you were trying to achieve. So resource alignment is quite essential from a very practical perspective. Leadership and governance at the systems levels. So again, just organizing yourselves around homelessness is one step, but how do you take that a step further? And leadership and governance at the integration level requires decision makers from across systems to move in the same direction on common objectives. And what if that objective doesn't include homelessness? Data and research and continuous improvement is, obviously an essential piece of this, and it's really difficult to see if you're making an impact if you have no systematic way of tracking it. And then, of course, this idea of community of practice, that you're looking at your ecosystem as a community of practice, and you're treating everyone at the front lines as part of a greater whole. So the same principles that we talk about at the homelessness focus levels, taking that and blowing it up further across the social safety net. And how do you create communities of practice at that level? So an integrated approach, and here we borrow some of the work that's been happening across the country, this one in particular from Lethbridge, the city of Lethbridge, and their work on safety and well-being. So here, where the community came together when they brought in the different systems, including homelessness, but also education, children's services, poverty reduction, etc., is this idea of community safety and well-being. And homelessness is certainly part of that, but well-being is a much broader term and much more inclusive of these various objectives and services that are existing in their community. And so when they did this work to connect the dots across systems and agencies for people that are looking for assistance, and taking that at this to the systems levels or ecosystem level, they wanted to ensure the leveraging was happening around these common objectives on well-being. They also created a community-based mechanism for governance, for strategy development, the funding coordination, and service integration across systems as well. So here's an example of how this can work in practice without compromising homelessness targets and goals or objectives that you might have, but actually leveraging that work into a bigger ecosystems approach. And so with that, what it's telling us, and reaffirmed by research that we're doing across the globe around prevention and what we know is needed from a individual, family, community, and societal level, is this idea of person-centered work, whether it's person-centered services or person-centered design thinking and systems development. We know that we are much more than our housing needs, for instance, and we know that people need much more than housing to thrive in communities. So outcomes beyond housing, but also how we can intervene earlier before people have housing instability through other avenues like income, or basic income is a common topic now. This idea of belonging and inclusion, recreation, meaningful daily activities, health and wellness, etc., and even things like access to information, especially in the digital age. This is telling us that we need to think beyond basic needs, and that these domains are obviously impacted by relationships, community, and societal context. But to really move the needle on homelessness, we need to look at it from an integrated safety net and look at that from a systems lens that includes but is not limited to our homelessness response. And that would really get us the desired impact and overcome our currently siloed approach. Thank you very much, and we look forward to your questions.